You might think you're done with me, but I gotta probably one more. I gotta probably one more my English, so let's do it. This is one of our favorite topic, ankle sprain. Everybody tired? Can you raise your hand if you sprained your ankle before? All right, twice, stay, twice, 3 times. This is the problem. That's exactly the problem. Once you sprain your ankle, the chance that you're gonna sprain again is as high as 80%. Once you sprain your ankle, and over, your ankle is gonna be, looks like a jello, so it moves all around, and then you can develop arthritis there and also instability. I have my ankle sprained more than 10 times, so I'm a living example here. Because I play soccer all the time, and then I sprain over and over. I thought I'm gonna be okay, but when I turn about 40, I can feel it affects when I run. So you start to affect your life in a certain time. Okay, so in the title I put the evidence-based practice. The gentleman right here is the father of evidence-based medicine, and he changed the whole healthcare environment. Quality improved tremendously. When you hear the evidence-based practice, everybody thinks it's all about past researches, right? But what he said was, first one is patient's value. We lose those kind of stuff. The best lesson I learned from my fellowship is when you hear very carefully to the patient tell me what is wrong with it, and then they even tell you how to treat. So patients need to be in the center. You need to spend a lot of time with the patient, taking histories, and then that's really going to help. Also, I don't think I'm more knowledgeable than anybody else here. The thing is, evidence-based practice includes clinical expertise, which means your experience counts. So when hopefully your experience and your past research is combined together, that's true evidence-based practice can be happened. Another thing is only half of the ankle sprain seek medical help because of the smartphone, Google, they just search what to do for ankle sprain, and the recommendation is just wait and see about a week, and then they're going to be okay. But the thing is, there are some, I call zebras, there's something else you need to be careful, and there are different grades of the ankle sprain as well. Who's at risk is very important. Everybody agrees that history of previous ankle sprain is the number one. Some people believe that's the only one. And other minor thing could be do not use external devices like ankle braces, and do not properly warm up. This is a big issue because if you put the players back to play, when they just showed up, you just go play and compete, you put a lot of danger in their body. They can get injured very easily. So stretching is very important, and dynamic movement, like drills, are very important before go back to play. And if somebody doesn't move ankle up enough, normal is about 10 to 15 degrees. If somebody cannot raise up enough, then they can sprain the ankle again. Also, there are some research shows that after the injury, you don't do balance training and proprioceptive training, you can injure your ankle as well. And last one, I don't think Nike gonna help like this comment, but some research shows if somebody wear with an L cell on the heel, 4 times more. So basically, Nike was not really helpful. If you go all the way down, basketball is number 1, football is second, and soccer is third one. Ideally, if you can pre-screen who's high risk of injury, and then practice some of the balance and proprioceptive exercises, you can reduce the injury. This is one of the tests you can do. Basically, you draw the 160 lines, and then you barely touch and then try to reach as far as you can go, and you measure right and left, forward, backward, medial, backward, lateral, and if somebody shows about 4 centimeter difference, it's 2.5 times more likely to have a low extremity injury. So this is a powerful test you can do, and then you can appropriately train them. Classification, I'm not going to go all detail. Basically, grade 3 is more detail. 2 special test is positive, and there's more grade of the range of motion limitation, and also function is limited as well. History is very important. You gotta ask, you cannot just send the patient to x-ray, you gotta ask, have you ever injured your sprained your ankle before? And that's very important question to ask. Also, able to bear weight or not right after in the emergency room is very good factor you need to consider to rule out fracture. And also obviously mechanism of injury, if ankle goes in or out, or we're gonna go more detailed later. And all the observation is important too. Next one is very important pictures. I think it's done by different country. They want to save the money because whoever walk in, they take a X-ray. And then this is very powerful because if there is a point tendon is posterior part of medial malleolus, and then lateral malleolus, and one navicular bone here, and 5th metatarsal bone of base of the 5th metatarsal, you can touch it. If one of the area is tender, X-ray is indicated. Also, unable to bear weight is one of the things. So, when you combine with the history and physical exam with this screening tool, you can conclude patient has risk of fracture or not. But the tricky thing is because it's high sensitivity, negative means you can clear, but positive doesn't mean there's a fracture, so you need to take an X-ray to confirm. So this one is good slide, shows deltoid ligament here, and then also anterior talar fibular ligament right here. This is between these 2 bone, anterior tibiofibular ligament here, and then this is we call syndesmosis. So it's very important to know which ligament is injured. Inversion, usually lateral side right here, because ankle goes in and down this way. And then eversion is very rare because deltoid ligament is pretty strong. So sometimes chip fracture can be happening right here. But there are zebra. This is something different we call high ankle sprain, or syndesmosis, syndesmotic ankle sprain, and then this is a little bit different. As you see right here, player, another player is put whole weight through this player, and then every force goes to ankle right here. Ankle is externally rotated and dorsiflex. So basically what happened is it starts from the deltoid ligament and it passes through this joint line, goes all the way up, so this 2 bone is separating. So we're gonna talk about later. Also linebacker right here is same thing basically, they try to block, but the whole force goes to this ankle right here, ankle is out, and then dorsiflex, which is ankle is up. Special test, I'm not going to spend too much time about it. If you check YouTube, there's all the special tests. This is a test to confirm there is a total tear of the ligament. So basically you stabilize the ankle and move forward. If the other moves more than the other side, you can confirm that that's positive. And another one is you just move the calcaneus, how they sprain. So move this way and compare to the right side and left side, and then you can confirm that there is a ligament torn or not. And the last one is the squeeze test. Squeeze test is right here. As I mentioned, the high ankle sprain is separate tibia and the fibula bone right here. So basically they put together and increase pain, that's the positive. And then external, this test external rotation test is basically move to the direction that cause that high ankle sprain, and if they complain pain, you can suspect about this one. So all the list here, the good thing is research shows which one is working, which one is not working. Believe it or not, because of that, we get the cutting the reimbursement. The insurance company doesn't want to pay something for not working. So we keep monitoring this one. And basically, ICE is pretty strong evidence. Compression elevation, not that great evidence, but still acceptable. And ultrasound and thermal therapy, ultrasound especially increase the swelling. So strong evidence not to use it, but when they use intermittently, which means you don't really hit it all the time, but you just take a break in the between, that one is a little bit different. But thermal therapy has a weak evidence, and NSAID has a pretty good evidence to reducing pain and swelling, but 1,000 people die because of NSAID. Aspirin can kill because of stomach bleeding, so you gotta be careful about this one. TENS, weak evidence, low laser, good for the swelling, but not significant for the pain and function. This is an important slide here. Early mobilization is very important. For me, when I sprain my ankle, I cannot just sit down and then not move it. When I get up and try to move it, it feels better. Because when you sprain your ankle, your joint can be a little bit of a misalignment. When you try to put the weight through there, automatically can go back too. But only for the grade 2 and 3. If there is a significant torn ligament, you cannot do this one, but research strongly suggests that early mobilization is and weight bearing is beneficial. And then therapeutic exercises is good quality evidence shows there are value. And manual therapy, we do joint mob, we do manipulation, we do mobilization with the movement, increase the dorsiflexion ankle up, and then proprioception means you know where the ankle at, and then that's very important thing. And weight bearing tolerance can be increased too, and moderate evidence for balance training. There was one of the factors that if somebody doesn't do the balance training and some of the proprioceptive exercises, they can get injured again. So this is important too. So this is a fun topic to talk about it. There is great amount of research shows which one is best to reduce the injury rate, reoccurrence rate, and systemic review, which means one of the highest level, shows there are not much difference between taping and brace. But you need to consider, because when you apply taping, it can be depends on who apply. Also, when you keep moving, taping can be looser. So they lose effectiveness around 30 minutes to 40 minutes. So you need to consider that one as well. And there is a lace-up brace that's good for the swelling, but semi-rigid is one of the strongest immobilization, but have a tendency to have a skin tear, and it's uncomfortable to certain players. So when it comes to choose the right tool to use it, you need to put your patient in the center, and you gotta combine with your physical exam. You gotta feel how your ankle is moving, and then how much limitation, so that when you incorporate everything, you can choose the right things to do. This is very well designed studies. I think the sample was several thousand, and there was some of the big debating was going on whether ankle brace increase the knee injury or not. Basically, when any kind of force goes to the knee, knee is primary observer, but ankle can be next one. So if we immobilize, then knee can get more force too, and then they can prone to have an injury. But this research is, one is for football, one is for basketball. Both of them shows doesn't increase. It do not increase knee injury when you apply the lace-up braces. So lace-up brace is recommended, and regardless somebody has an ankle sprain or not, they have a benefit. So hopefully that helps for everybody. Importance, I think I already mentioned, you need to see the healing process, you need to feel how it moves. So also you put the patient center, you need to hear how they feel comfortable with taping or any kind of devices. Even taping is not same old. Some taping has good immobilization, but kinesio tape can allow to move it. So you gotta put the patient center and incorporating your physical exam, and history is very important. Number need to treat is very interesting number here. If you put the brace on 5 times, you can reduce 1 ankle sprain, which is a crazy number. So when you look at the cost and benefits, it's worth it. Because once you sprain your ankle, you're gonna spend a lot of money. So this is some of the manual therapy we do. We work on the knee, we work on the ankle directly, we do mobilization with the movement, we do grade 5 mobilization right here. That one has a pretty good research shows there is a huge benefits. So not everybody needs to do manual therapy or physical therapy, but if somebody is high risk of reoccurrence or somebody has a weakness, they recommend to do exercise and physical therapy and manual therapy as well. This is done by actually one of my director for fellowship, Julie Whitman, is done this clinical prediction law. This is one of the big components. Every researchers want to do it. And basically, there is 4 factors. When 3 out of 4 is meeting, then 95 of them has positive response. So these are things that you need to look at whether they're going to benefit for the manual therapy or not. This is my wife's leg. She refused to be on the picture, so I just take a picture on her leg. She's not here. So basically, there are huge benefits when you use this unstable board and you can play with it. Initially, you put less than 50% of weight here, but little by little, you can put more weight, so you get used to it. So ankle move in and out and make a circle, all kinds of stuff can happen. Even with this posture, you can throw a ball and catch it, and there are 4 more. You can stand up there and then with a one leg, or you can toss the balls together. So there are so many stages you need to get used to it. I can pass very fast for this one. This is all the details, what the therapist can do for the ankle. This, I want to look at this exercise right here. Basically, when she do this exercise, which leg is working, right or left? Nobody want to talk anything? Okay, right side. Because she tried to reach it, and right side is working. And with this posture, we apply some resistance, and she can try to reach as much as she can do, all direction here and here. That can be really one of good exercise to stabilize the ankle as well. Let's talk about Nike. No significant difference found high top shoes and low tops. So you see in the professional basketball play, they don't wear this high top not much anymore because research shows this one doesn't make any changes. And then again, if anybody wear air cells on the clutch jacket ready. Basically, you're standing on the board actually, so you can sprain the ankle easily. And it's gonna go on the YouTube, and I'm gonna be in trouble. But it's not me, it's a research shows there are problems. This is one of the important things you need to consider. You need to do some sports-specific warming up drills. You cannot just send up players back to play without warming up exercise. and you gradually increase the speed and everything, so players get ready to do. That's very important element you need to incorporate when it comes to reducing the lower extremity injuries. Return to play is one of factors you need to be careful. If you put them too early without healing process, without muscles not really know what to do, and then balance issues, they can get injured. So basics, no swelling or pain, no feeling of instability means your ankle doesn't feel like a jello, it feels steady, and then you need to consider appropriate healing time. And then there is some test you can do, and every test and the examination here, test you can find in the YouTube too. And then there are hop tests, they can measure right and left, and then if the injured leg close to 80% of uninvolved side, they can start some of the participation. Last one is, I think, concussion. We discussed about this one. You cannot just put the player back to play right away, but you need to simulate the situation that put the players in danger, and then you start from the less dangerous motion first, and then little by little you get close to that real sport. If you just, because ankle sprain, any kind of injury is nothing like a skin tear. Skin tear, you just wait and see, and then you're good to go, right? But any kind of musculoskeletal problem, even any kind of nerve involved, you need to have enough time to go back to play, and then that time you need to gradually expose to the real sports. You cannot just put them and play, then they're gonna get injured. This is very important. Okay, this is my process, and that's